I'm Demetrio Aguila. I'm a peripheral nerve surgeon in the Omaha, Nebraska area, and I trained under Dr. Lee Dellen from 2012 to 2013. Um, you know, where do we start? I was asked to put together a quick video expressing some of my feelings, sharing some memories, some ideas, some thoughts regarding you, Dr. Dellen, and the impact that you've had on my life. And this has been a really fascinating journey for me. I started out as an ear, nose, and throat surgeon. I got deployed. I ended up finding an interest in reconstructive surgery, so I went to Hopkins to do my plastic surgery training, and that's where we met each other. Um, and I remember meeting you and thinking to myself, you know what? Dr. Dellen has some unconventional ideas. Maybe there's something I can learn from him. And so I decided, you know what, let's do this. And so you took me under your wing and you trained me. And I figured, this would be just one more arrow in the quiver. I didn't realize how much of a difference your training and your perspective would have on the way in which I approach patients and the way in which I treat patients moving forward. And I remember the day that all of that changed. I remember it very distinctly. I don't know if you remember or not, but I had this patient whose leg got stuck in a Humvee in the middle of a firefight, and they had to yank him out of the Humvee as it was on fire, and he ended up with a peroneal nerve injury. When I saw him, he was wheelchair bound, and he had horrible pain. He couldn't walk. And I evaluated him. I said, I think I know what's going on, and I'm going to get you the help you need. And so I called you up, and I said, Dr. Dellen, I got this patient, and he really needs your help. He said, okay, tell me more about him. And so I did. I told you a story, and you said, oh, yeah, I think you're right. I think it's probably a combination of common peroneal nerve and superficial peroneal nerve. I said, great. So you're going to help him, right? And he said, yes, I am going to help him. I'm going to have you do his surgery. I said, no, wait a minute. I said, I promised this guy that you were going to help him. And he said, I am going to help him by having you do his surgery. And I said, no. And he said, yes. He said, you know the anatomy, you've had the training, you know the procedure, you know what needs to be done. Just get in there and do it. But I promised him that he would have your expertise. And he said, he will have my expertise through you. You're going to help this man. You're going to show him that you can make a difference. And I got an email from him 2 months later. He had passed his physical fitness test. He was out running, doing combat fitness tests, and he was getting ready to deploy again. And he was very thankful. He got his life back. I think back about your career, what parts of it I know about, and it's really amazing that you've had all these speaking engagements, you've had all these invited lectures, and when you take a look at that in light of all your publications, I mean hundreds of publications between the textbooks and the textbook chapters and all the articles that you've authored or co-authored, it's really quite amazing. But all of that pales in comparison to the impact that you've had on the lives of patients, of real people. And I'm not just talking about the patients that you operated on, the patients that you saw. I'm talking about the patients that you've never met, whose lives you've impacted by the work that you've done. It's great to see all of these accolades. It's great to see certificates on the wall. And it's great to get those pats on the back from your colleagues. I mean, nobody will deny that. But none of it matters if you don't make the difference in the lives of people, of real human beings. And that's what you've done. But don't take my word for it. I want you to hear it directly from the people who were affected by the knowledge that you uncovered, that you discovered, that you passed on to people like me and Tim Tolstrup and Eric Williams and so many others. The lives that you've touched and impacted through our work.
He really, really changed my high school life in a way.
Oh, thank you. And if I could hug him, I would give him a hug.
I'm just looking forward to doing everything and anything.
Right now I'm running 65 miles a week, which is not a whole lot for a distance runner, but it's a start. And we're starting to do track workouts and hill workouts, and it's feeling fantastic.
And we scheduled the surgery in April, and by summer, the pain was completely gone.
Scar tissue wrapped around the nerve was impinging on it. So he went in and cleaned it up and opened it all up, so the nerve is free now. So no more restlessness, and I can sleep all night.
So we're actively training for our first racing cycle right now.
What are the long-term goals here? Are you hoping to maybe make it to Olympic trials again?
That would be a long-term goal, but just now in the future, we are just very thrilled just to be running and to be competing again.
I thank him for giving me my life back and for helping so many people who really didn't have many other options or places to go to. And I tell him how much I appreciate what he's done for me.
I would tell him, thank you. Thank you for giving us our life back.
I was in a wheelchair for 15 years. Now I'm walking a mile in 20 minutes and making 2 miles in 40 minutes. I feel younger now than I did in my 30s. So,
because I've probably been to 20 some doctors or more, and this was the only answer to my pain. So I'm really looking forward to getting back to hiking. I believe God, He directed me here.
I mean, it's what I've prayed for all these years. You know, just the thought of being able to get my life back. You know, I'm kind of lost hope. So He gave me hope.
He gave me my life back. I mean, that is the story. It is only because of him that I'm sitting here today crying tears of joy instead of tears of pain.
I would just say, like, people with chronic pain have moments or times that they give up. You just can't. And don't miss an opportunity to let him step into your life and give you your life back.
It changed my whole life, and it stopped the migraines. It stopped them. I could do things. I started living life again. I don't even have headaches. I am used to waking up with a headache. You know, you get off your head and it'll kind of go away, you know, but I have nothing. And I can't tell you how grateful I am. This surgery it's groundbreaking. It is life-changing. It is everything somebody like me hopes for. And I am just so thankful for all of it. It's a miracle.
Dr. Dellin, when you look back on your career, there may be days after you've now retired that you wonder if it was worth it, if it was worth all of those discussions and arguments and debates with the naysayers and the skeptics, and whether or not you've made a difference. Well, rest assured, have no doubt that you've made a difference. You've given so many people their lives back, people who you've never met. And know this, your legacy will live on through people like me. and all the other people that you've trained. And your impact will be felt for generations to come. Thank you for everything, and congratulations on a full career and a life well lived.
Professor A. Lee Dillon, MD, PhD, retired. Dear Lee, I'm very happy to have the opportunity to say a few words to you, and I thought it would be nice to have some illustrations on the left-hand side here. You see your last case in the spring of 2022 after retiring then from clinical practice. I met you first in 1989 in a international meeting in the Netherlands, and you were a keynote speaker among, at that time, also well-known speakers like Professor Gilbert, Professor Berger, and I think I remember I was driving you around from the hotel to the venue, and your lectures made a very big impression on me. And this resulted in the fact that I visited you in Baltimore the next year, attending your peripheral nerve workshop you were hosting for many years. And at that time, you were still at Green Spring Avenue at the Children's Hospital. And after the workshop, I was also spending time with you in the operating room and in the clinic and observing your patient care. And that made a very big impression on me. After 6 weeks, I returned to the Netherlands, but the base was set that I wanted to spend time with you in research, and this happened all in 1993. And as you see here, I was very happy to publish quite a number of papers with you at that time under your guidance. And this also resulted in the fact that you proposed me to become member of the American Society of Peripheral Nerve, which happened in 1993. So this year I'm celebrating my 30th year membership due to you as my mentor, but also as founding member of the society. After that, I returned to the Netherlands and I went through general surgery residency and plastic surgery residency. During the time we stayed in contact, I was still giving some of the talks that were based on the research that I did with you at that time. But around 2001, I was actually finishing up my plastic surgery residency, and you were starting a new peripheral nerve fellowship, and I was honored that I could be your first fellow. Unfortunately, a big disaster happened in the world, the attacks in 9/11, and as a result of the fact that I was not able to come over because as a Dutch citizen, I was not able to get a visa. I still did a fellowship in New York, for which you also helped me as a reference, so I'm still very grateful there. After that, I returned to the Netherlands and went into practice. And in 2006, with you as one of my advisors, I defended my thesis entitled Management of Peripheral Nerve Problems. After having done that, you were also very keen in pursuing your own PhD, despite your many, many publications, your many, many book chapters, and your many, many books. You always said to me that you were initially in NIH research and wanted to pursue a PhD, but at that time you went into clinical practice, into residency, and was not able to pursue that. So at this point, you were pursuing it, and this is actually very honored in my university, University of Utrecht. And you see here, we're leaving the room for you to defend your thesis. And this is my predecessor, Professor Moshe Cohn, giving you a doctorate in the usual way, like we've been doing for over 480 years. And here we're celebrating your doctorate with the doctorate already in your hands. The years after, you were so kind to come over and lecture us and teach us in the Netherlands. There were also nice dinners, and we started in 2016 a multi-center RCT based on your concept of decompression of nerves in diabetics. And here you're teaching at a pre-course to teach residents and fellows how to do the procedures. Also, you were involved in my career in the sense that when I was being considered as professor and chairman at the University of Utrecht, you were one of my references and very helpful in helping me obtain this position. So I was appointed in August 2015 and was giving my inaugural lecture in 2017. You came over to attend, and you're here being dressed in the usual manner in the full regalia by my predecessor, Moshe Kohn. You see here together with Luann, and this was the lecture, and here we're celebrating afterwards. And you put your cap on my oldest daughter, being a little bit younger at that time. So after the years, she still came over to teach in the Netherlands, and we had nice dinners and get-togethers at our house. And I was also honored to be a part of this group quite recently in Dubrovnik, and here there's a nice picture together with your fellows. So Lee, you had an amazing career, too much for me to describe, and I leave it gladly to others, but I just want to tell you the impact you have had on me as a surgeon, as a person, and also as a researcher. I'm very thankful of your support, but also your friendship over all these years, and I wish you all the best, and of course a good retired life. Thank you, and I wish you well.
Good morning. My name is Oscar Asman. I met Lee Dellen in August of 1994. This is almost 30 years ago, which is really amazing, I think, for an academic friendship. I was a young student, 25 years old, just out of medical school. I had basically no clue about much. And I just knew I wanted to learn nerve surgery. And the reason I came to the attention of Lee Dellen was because of a small paper published in the Journal of Reconstructive Microsurgery that I read about the bands of Fontana. And what fascinated me about that paper was the fact that somebody can write on the history of medicine, about neurophysiology, about the clinical significance of all that. And I thought, I want to learn from this guy. So I went into the plane and I flew over to Baltimore, and I met Lee in between two surgeries. I was very nervous that I was about to meet the big professor. And he said, I didn't have time to talk to you. So he just threw me some scrubs, and immediately I delved into this world of Lee Dellen at that time. I appreciated so much the 2 years I spent with him, 1995, 1996. Because he took me to almost every meeting. He paid out of his own pocket. He shared his knowledge freely. And I am so thankful to you, Lee, because I think my life of medicine would not be the way it is without your investment. So cheers to you. We love you. We love the way you lived, the way you shared your talents with all of your students. And so we are happy to be amongst those whom you have invested your time in, and we celebrate with you today. Cheers to you, Lee. We love you.
I'm Dr. Sofia Pekova from University Clinic for Plastic and Reconstructive Surgery in Skopje, North Macedonia. I met Dr. Dellen through Dr. Asman, a person who introduced me in the world of peripheral nerve surgery. When I first met Dr. Dellen, I was amazed by his spontaneity, patience, and enthusiasm. Dr. Dellen inspires and awakens creativity in all of us. With his support, we introduce a new peripheral nerve techniques in our country. He is an amazing person. As there are no boundaries or limits for scientists, Dr. Dellen proved it and came to my country, although my country is 1,000 miles away from US. During his visit, he had the patience and energy to talk and discuss to all my colleagues, to teach students about peripheral nerves, and to give us puzzles to solve it. With his spontaneity, he made my colleagues to focus more on peripheral nerves and to think about peripheral nerve conditions and treatment options. He only confirmed Dr. Asman, and my 10-year mission to steer the wandering ship of plastic surgery in my country toward right direction, toward reconstructive microsurgery. We succeed with a lot of efforts, and Dr. Dellon opened new horizons and destination for us. Yes, he's a man whom energy and creativity are in an infinity loop and complementing each other all the time. So this year he surprised us by giving the world his new novel, Prosector, and I think you should all read a book where the history, anatomy, surgery, feelings are woven together in a surgically precise manner. A book that when you read it, you want to read it again and again, because believe me, there are many hidden messages in that are worth a lot of. Only a giant like Professor Dellon can create such a masterpiece. I am truly honored to work with you, Dr. Dellon. Congratulations on your work.
Hi, Lee. First of all, I'd like to say congratulations on a lifetime and career that will be impactful and meaningful, obviously, for many, many, many generations to come, as it has already been on many current generations. In terms of personal anecdotes, I just wanted to share my personal experience with our first ever conversation where you and I met, and, in such simple forms, which is really how in so many ways people have such meaningful impacts on other individuals, seemingly by very simple sentences. You asked me one question, which is, why would you not want to embark on a field where there's so much opportunity to help so many people, and yet so few people see the possibilities? And I think that it was really food for thought at the time, and obviously changed my career from a focus on craniofacial medicine to peripheral nerve surgical interventions, and the rest is history. So once again, I want to thank you for all of your mentorship, your leadership, and your vision, and I wish you the happiest days ahead for you and your family. Cheers.
First of all, I want to say congratulations to Dr. Dellon for an amazing accomplishment, another one on a list of many in his career. And I want to also spend some time to give you thanks for all the things that you have helped me with over the years. I've had the rare privilege of working with Dr. Dellon since 2006 when I started a fellowship with him. And so it's been quite some time that I've been able to work side by side with him. And, I feel lucky just to have picked up a fraction of his love of peripheral nerve surgery, of his love of trying to help patients who have difficult pain problems. And it really started with that very first visit as introducing myself to his fellowship when I came to interview. He was so sure that he had answers for so many of these difficult questions. Patients I've never seen in my life before, despite having general surgery and plastic surgery background. It was just so interesting, and his enthusiasm was nothing more than just infectious. It got me so excited that when I went back to my training program, went back to the VA, I found a few patients that had some problems that otherwise I would have just blown off. One was a toe amputation, for instance, and had terrible chronic pain. And I was struck at how much he actually helped me. I would email him back and forth about how to care for these patients in the VA. And we would create care plans and protocols, and it was just an incredible experience watching these patients improve. And the amount of time that Lee had spent with me with those patients was admirable, and really just hooked that enthusiasm in me to do the fellowship, to spend the time with him, and then, the rest is history, as they say, and been able to work with him very closely for many years. And I just want to thank him for his generosity. His patience during that fellowship was a perfect mix of autonomy, but also oversight and freedom versus guidance. It was just a perfect situation for me and my growth and where I was at the time. And you know, the thing that really strikes me the most about Lee Dellen is his true need to create new information, to solve old problems with, to improve outcomes, then to write those and then to teach them to other people so that we and others can help those patients in need. And it's really for most of us, it's a job, it's a chore to create that information. But for him, it's just like breathing. You know, if he doesn't have that, he's just not breathing. And so it's a very unique situation. Not the kind of person you want to be in the room with you if you think you're the smartest one in the room, but definitely the kind of guy that you want to have in your corner to back you up when you have a difficult situation, when you have a patient you're not sure what to do with, you're trying to figure out a peripheral nerve situation. Just a blessing for me to have had him guide me and lead me over the last many years of my practice. I'm just so thankful for his gift to me of the knowledge that he's provided and the knowledge he's provided to so many other physicians over the years, both medical doctors but also podiatrists and scientists and medical students. It's truly humbling, the accomplishments that he has had. And I'm just personally settled right now in the point that I'm just happy to use the skills that he's helped me acquire, trying not to keep up with all the wonderful things that he's done, but at least trying to share that with other people, trying to help those patients who come to us, and just always remember who it was that really taught me how to do that, and to share that knowledge and to continue on helping others with that knowledge. It's been just an incredible experience over the past 14 to 15 years. So I just want to say again, congratulations, Lee, for all the accomplishments and this next accomplishment, and thank you for all the time and the effort. So, thank you.